Hi, I'm Tom Bagwell, and welcome to Hello Health, a weekly education and information series in partnership with the Ochsner Health System and Humana. Today's topic is pain management, including new breakthroughs in pain reduction. Our guest is pain specialist Gassan Chaiban. As always, we begin with some background, so here it is. Dr. Gassan Chaiban received his medical degree from the Ross University School of Medicine in the West Indies. He completed his residency at the University of Massachusetts Medical School in Worcester, Massachusetts, and a fellowship in pain management at the University of Toledo Medical Center. He is certified by the Board of Anesthesiology, and he is a senior physician with the Interventional Pain Management Department of Anesthesiology and Critical Care Medicine, as well as the program director of the Pain Medicine Fellowship Training Program. He's also an assistant professor and senior lecturer at the University of Queensland Medical School and a clinical assistant professor at the LSU School of Medicine. And he's a local, hailing from Bonneville High School in Kenner. He was proud to provide that. And it is our pleasure to welcome Dr. Gassan Chaiban to Hello Health. Good to have you with us on the program.
Thank you. Nice to be here.
What do you remember about your Bonneville days?
Well, so I was, a band nerd actually, and so I wasn't really the most popular person there. But, that's the only schooling that matters when you live in the city, where you went to high school. So I feel like I needed to represent Bonneville High School.
Good for you. What was it? Were you even back in those days? So you mentioned you were in the band. But Did you enjoy math and science? Did you think you'd end up in a career of medicine?
As far as I can remember, I always wanted to be a physician. I didn't know that I'd specifically be a pain doctor, but I didn't actually know that existed at the time. But I'm happy I did. It's a very rewarding career.
Good for you. Let's start with the differences between chronic pain and acute pain.
Yeah, so one of the things that we like to differentiate is that, chronic pain is actually a very different process than acute pain. And acute is meaning that it's happened suddenly. If you break your arm and you have pain in your arm, that makes sense to everybody. But chronic pain is usually pain that persists after normal healing would have been expected. So 3 months after you've broken your arm and your arm looks like it's put together again, if it still hurts you, then we have to start looking into the reasons why. And that's where chronic pain can come from. So usually we don't know what the source of the pain may be. There might not be any big physical findings. Your blood pressure or heart rate might not be affected by your pain, but your pain is definitely still there. And it's very common.
What are some of the options for treating chronic pain?
So one of the things is there is no one trick pony for treatment of chronic pain.
We're all different.
We're all different.
Injuries are different and we're all different.
That's exactly right. And so the thing is we try to tailor somebody's treatment to whatever their pain is, but we usually try to use what we call a multimodal approach to treatment of chronic pain because there's no one thing that's going to take care of everything. So when we talk about multimodal approach, sometimes it means that you might need some medication. Sometimes it might mean change in lifestyle, like weight loss or exercise. Sometimes it might need specialty physical therapy training. Some people get affected by their pain in a way that affects their behaviors with their families. So psychosocial relationships with their activities of daily living being affected. So some people need some therapy, like cognitive behavioral therapy or biofeedback to try to help them manage the day-to-day with living with pain. So it's never just one thing, and we try to tailor somebody's treatment by incorporating some of all of these aspects to help somebody with their pain. And then what we also add to the table from an interventional perspective are injections and procedures to try to help us determine where somebody's pain is coming from to make sure that we eliminate any dangerous or scary reasons for the pain, and then also see what options may be available to minimize pain and treat pain in addition to everything else.
And sometimes those two things happen at one time, right?
That's right.
While you're inside, you may be able to take some of the pain away while trying to decide where it's coming from.
That's right. Yeah. So sometimes our procedures not only help us from a diagnostic perspective, they might help us from a therapeutic one as well. So it may actually get rid of the pain, and that's a win-win. So, we're always happy when it happens.
We like to invite viewers to provide questions for us. So let's do that now, Doctor. This is from Deanna. Will I become addicted if I start taking pain medications? And I know the doctor wants to talk about opioids later, but just in general, her concern about becoming addicted to pain meds.
So addiction is a complicated process. And the simple answer would be no, not everybody becomes addicted to pain medication. And what I'm talking about specifically with this is opioid-based pain medications, because pain medications come in all kinds of variety. There's not just opioids that treat pain. So anti-inflammatory medications are some of the medications that we use, and then there are also other medications such as anticonvulsants, which help with nerve pain. So usually a lot of the medications don't have any addictive quality. Opioids have been shown to have problems with addiction, and so we try in our best way to limit people's use of opioid medications so that we help minimize their chances for getting addicted. But the simple answer is not everybody becomes addicted to them, but if you use them with regularity, everybody becomes what they call dependent on them. And that's a fine line. Dependence means that your body becomes used to having the medication in you. So what can happen is if you suddenly take that medication away, you may develop withdrawal symptoms from that medicine suddenly being absent. Okay? But it's not necessarily an addiction.
Are doctors more cognizant of the problems, and are you more cognizant of the problems?
Yeah, so one of the things that has become a major problem is that there's an opioid epidemic that you're hearing about all over the news. And it's everywhere from major news on a national level to local news here in the city. One of the big problems is that the overdose rates of people taking opioid medications, prescription medications, has increased tremendously. And it's been going up steadily over the last several decades. And the problem hasn't seemed to find a solution, but one of the things that is an initiative that has been launched by not only Ochsner, but on a nationwide level as a whole, is trying to reduce the amount of opioid prescriptions that are being written for patients, and also try to find alternative treatments to help them with their chronic pain so that opioids aren't the mainstay of their treatment. In doing so, we're trying to find ways to reduce people's dependence on those medications. So when we look at data that has come from 99 to 2007, there has been generally an increase in people's deaths from all prescription medications generally, but the biggest drive of increase is coming from opioid medications specifically. And so the number has kind of increased exponentially. And so even between 2013 and 2014, the increase has been something upwards of like 80% increase in the amount of deaths from opioids. So it's become a national crisis, and so lots of attempts are being made to help reduce people's risk of becoming dependent, like the question had asked, and also find better ways to treat people's chronic pain.
Just the fact that Deanna asked the question hopefully is a good sign that patient awareness and education is important.
People are always concerned about it. A lot of people are scared to start those medications for fear that they would become dependent on them or addicted to them, even if they do help them with their pain temporarily. So when people come to see us, we try to see what we can do to alternatively help them, and also what other medications we can try that don't necessarily have the same treatment as what an opioid would do.
Good conversation to have with your physician. What are some of the dangers and things that can happen if chronic pain goes untreated?
So chronic pain can affect every facet of your life, you know, and so one of the things that you think about when you have to deal with pain every day is how it will change your ability to do the things that you love on a daily basis. All right. You can't function the way you wanted to. Some people simply want to be able to wash their dishes or clean their house on their own. Some people, they need to be able to work on a daily basis with as little pain as possible. So one of the things is it decreases your function, right? You're not able to do the things you have to do. Some people, they have so much pain that they're unable to sleep well, all right? And whenever you don't sleep, that also can affect your mood, right? So pain on a daily basis, not able to do the things you want to be able to do, is definitely going to affect your mood, and that's going to affect your personal relationships with your friends and family. It's going to make you a little bit more socially withdrawn, uninterested in doing the things that you really want to get done, and that will kind of help, or make you kind of withdraw from society.
You mentioned earlier, part of what you do is try to identify where the pain is coming from. Mm-hmm. Why is there pain in the first place? If untreated and just ignored, it could be a sign of something even more serious, disease, right? Even beyond just living with the pain and lifestyle.
Oh, absolutely. And also, the longer that your pain goes untreated, the more you're going to become used to a decreased quality of life. And then it makes it a little bit harder just from a psychological perspective to overcome that hump in order to get back into being fully functional and active. So that's something that we definitely try to incorporate into somebody's treatment, is getting people as back into their activities of daily living as we can. Improvement of function alongside reduction of pain.
The doctor's got some great information to share about the opioid epidemic. We'll talk about that in just a moment. But first, another viewer question. This is from Morgan. How big of a role does diet and exercise play in pain relief?
So diet and exercise plays a very important role, and for very many different reasons. So one thing is that as we age, we don't tend to age like wine like we like to think, okay? So we tend to fall apart a little bit as we get older, and one of those things is what's called arthritis. Now, arthritis develops in a lot of our joints of our body, from our ankles up to our neck. And so it's a purely mechanical issue for a lot of people, meaning the more weight that you have to hold up with the joints of your body, the less mileage you're going to get out of all the joints of your body. So
it's a physics question.
Yeah, basically. So the less weight you have, the more you're going to get out of it when we're looking at the long term. So weight loss is definitely an important thing for long-term health and well-being. Usually when patients come to us with joint pain, I usually tell them, like, you want to try to lose weight, but it's not going to help you in the immediate time frame. It's not going to help you right now. What it's going to do is it's going to help slow down what's to come when you look at where you'll be in 5, 10, 15 years from now. And that's one of the principles of chronic pain management. We're worried about you right now, but we're also worried about where you're going to end up. So definitely that has something to play in it. Diet is also important, in particular for women. Osteopenia and osteoporosis is something that is prevalent throughout people as we age, more prevalent in women.
Weakening of the bones, thinning of the bones.
Correct, yes. Weakening of the bones and thinning of the bones, which, making sure that you have a proper diet can sometimes help slow that down, making sure that you have nutrition, vitamins, vitamin D, calcium. Also things like magnesium and phosphorus can help with joint aches. So there are a lot of things to make sure that you don't have deficiencies in order to help reduce some of the pain that you may experience. So those things definitely come into play. So exercise, also very important. Stretching muscles, making sure your muscles are strong. Those help to support the joints and structure of your body. Muscle aches come from muscles that are deconditioned. When you're not used to exercising your muscles, you may have pains that you wouldn't have had otherwise. So exercising and strengthening those muscles will absolutely help decrease the components of pain that you're able to control.
And we understand that's not always easy, because if someone's in chronic pain and you're saying time to go exercise, it's tough enough for people who aren't in chronic pain to get motivated to go exercise, yet alone people who are in chronic pain. Right?
Definitely.
So we understand it's not easy.
Yeah, so there's a chicken and egg part of this, of course. Where some of the treatments that we do through interventions come into play is that we hope to be able to temporarily decrease somebody's chronic pain so that they are able to jumpstart and get into that. So if we can take the bulk of your pain that's really limiting you from being able to do the true things that will help you on the long term, like diet, exercise, etc., we try to do some of our procedures to temporarily reduce the pain so that you can get the ball rolling with those exercises. But typically, anybody that starts doing some activities, if they've been out of the game for a little while, if you haven't been doing those exercises, it's going to make your pain worse when you first start. And that's just a matter of fact. That's just the way life is, But once you get past that, then hopefully your pain will decrease, and that will help you more for the long term.
We touched on opioids, but I know you wanted to spend just a minute talking about it. And any advice you would give to patients who have this concern, as we heard from our viewer earlier, but also understanding that they can be helpful either in limited use or whatever?
Yeah, to say that opioids are a problem in and of itself in terms of a treatment for pain is a little bit excessive. They do have their role to play, and very particularly in people that have an acute pain, like a broken arm, okay? But when it comes to chronic pain, it can absolutely become a bigger problem if you develop addiction or dependence to those medicines than the original problem of pain to begin with. So what I will say to people out there that have concerns about opioids as part of their treatment, or people that may have problems with addiction, is that Ochsner has been spearheading lots of programs to try to help treat people that have problems with addiction or dependence on opioids. There have been whole committees that have been developed at Ochsner to try to help curb the prescribing of opioids and to help people when they do develop problems with addiction. And resources are absolutely available to help, especially if you or someone that you know in your family you think has problems with opioid medications. It is a good time to come in and see your doctor and start a conversation about how to break that addiction and what available resources we have to help facilitate that. And at the same time, try to see what we can do to help you from a pain perspective decrease your pain so that you can continue to function and not be miserable without your medication.
Are people who would tend to be addicted to alcohol or recreational drugs, are they more likely to be addicted to opioids? Is it more of an addiction question than it is an opioid question?
For addiction, sometimes yes, that's the case. So people that have addiction that runs through their family or their history, their own personal history, it may make them a little bit more susceptible to developing an addiction and changing, one thing for another, replacing alcohol with something like a pain pill like morphine. But that's not always the case. People that don't have a history of addiction in the past, sometimes when they start using these medications, they may develop an addiction with time. And the importance is to recognize whenever addiction is happening and try to curb it early and also prevent those behaviors, that social repetitive pattern of behavior from developing to where you need to use it almost like smoking.
Hopefully we've shed some light here that will be helpful today. What are some of the specific conditions you're treating in your practice?
So some of the conditions come from chronic pain of any sort. So predominantly things that come from the musculoskeletal system, like people that have chronic neck pain or back pain, or people that have things that they call sciatica, like pain shooting down into their leg or arm from a disc that's bulging out or pressing on a nerve. People that have had previous back surgery, whose pain still didn't get better. There are some other conditions like chronic regional pain syndrome for people that have had injuries to nerves that they develop persisting pain that can sometimes be so severe that people can't wear clothing because just the clothing touching the skin can be aggravating. We also treat people that have chronic headaches, migraine, okay? And then people that have other types of nerve pain like diabetic neuropathy, which I also want to touch on a little later in the program. So that's nerve pain that comes from damage to nerves from diabetes. And then also, unfortunately, people that have cancer and cancer-related pain.
So what are some of the ways you're able to treat these conditions?
So we try to find out what a person's worst pain is when we're evaluating them and see where we think their pain is most likely coming from. And one of the things that help us with the diagnosis of a person's pain are the injections that we do. The injections don't always get rid of the pain, but depending on where we're doing our injections and what we are injecting a patient with, we can use their response to our injections to help us make a decision on where to proceed in terms of their treatment. So our injections, while they don't always treat and fix somebody's pain, may help us eliminate a source of pain or guide us towards a source of pain. So one way I can say is if you go, for example, to a dentist with a toothache, it's not at one tooth that's going to hurt you, right? The whole side of your face is going to be screaming with pain. So if, for example, I numb up the tooth that I think's the problem and all of your pain goes away, I'll say, oh, great,
Got it.
Probably that tooth. But if I numb it up and your pain's still there, well, now I know it's not that tooth, right? Which is also very useful information. Maybe it's the next one. And we go from there. Does that make sense?
Yeah, absolutely. Let's talk about radiofrequency ablation and that procedure. And I think we actually have a video that the Ochsner folks have helped prepare.
Oh,
right?
yeah, absolutely. So radiofrequency ablation is definitely something that we use to treat joint-related pain. Once we identify that pain has come from the joints, we can target the nerves that supply the joints and hopefully get rid of pain from that.
Great. Let's take a look.
Okay. So the idea with this procedure is that what we've done is we've identified that the patient's joints of his lower back were the cause of his pain. And so the way we do that is we do a test block first where we put needles where we're putting these probes now, and we just inject numbing medication to see if the pain goes away while it's numb, letting us know that this is the source of pain. Once we confirm that, now we come back and do the same procedure where we place needles exactly in the positions we did the test. But instead of just putting numbing medication, These probes are actually working with a computer to help destroy the sensory nerves that supply the joints in the lower back. Once we destroy those, he should feel the same type of relief that he felt during the test block, but for an extended period of time. The temperature is set to 80 degrees, and we're going to keep it at 80 degrees for a total of 90 seconds, which maximizes the area which can cover to ensure that we are destroying the sensory nerves that we want to destroy. And once we do that, that destruction is going to be translated into pain relief for his lower back. So after this is done and he develops some pain relief, the plan will be to have him do exercises, therapy to keep the core strong, to help extend how long he has duration of relief for his back pain.
In this case, who was that masked man? That was you, right?
Yeah, that was me.
And you mentioned relief for a longer period of time, and you're destroying nerves. Does that mean in some cases the nerves can grow back?
Well, so the nerves do grow back, right? And that's what determines how long somebody may get relief from it. So I wish that I can say that this was permanent. And one thing I want to point out is that I made a point in the video to state specifically that we're destroying sensory nerves. So I don't want people to think that we're destroying something that would involve motor function for, like, for example, the leg or the arm. So these are just nerves that would create pain coming from the joints. But yeah, the nerves usually grow back over the course of about a 6 to 8 month period. Now, sometimes the pain will come back exactly the same as it was before we tried to destroy it. Sometimes it comes back with less severity. And one of the differentiators for that are people that feel enough relief to be able to get into some of those exercises that will help strengthen all the support structures for those joints.
And over the long haul, they're better off.
Absolutely.
What about spinal cord stimulation?
So one of the things is spinal cord stimulation is completely different from our treatments with radiofrequency for the joints. This is actually something that we've been doing for the last several decades to help people with pain that comes from damaged nerves. And so people that have had a history of, for example, surgery on their back because they had a pinched nerve and they had a lot of damage, who have continuing or persisting nerve pain that medication hasn't been able to help, we can actually implant a device almost like a pacemaker but for pain, okay? And what this device will do is it will interrupt the body's ability to perceive pain coming from a damaged nerve by interrupting its ability to relay to the brain. What the diabetes can do is it can cause damage to a lot of the small nerve fibers of the body. And people will develop a tingling and numbing sensation in their feet or hands that never seems to go away. Now, traditionally, we try to treat that with medications. So some of the common medicines that are used are things like gabapentin, also known as Neurontin, or pregabalin, also known as Lyrica. Those are anticonvulsants that are tailored to help with nerve irritability specifically. What they don't do is they don't fix the reason why the nerve's damaged, all right, and neither does the stimulator. But sometimes when people take these medications, despite the medicine, you still have a lot of this numbing or pain from tingling sensations that doesn't go away. And it can be really unnerving to a lot of people because it's something that will not get better with time because those nerves have been damaged. They're not necessarily going to heal themselves so well. So the stimulator is an implanted device that we can do in order to try to help mask that pain and allow people to function potentially without the need for any medication at all.
What's the difference between what is DRG and what's the difference between that and spinal cord stimulation?
So DRG is a version of spinal cord stimulation, but it's much more targeted. So what spinal cord stimulation will do is it will be cast widely and programmed in a way to cover a person's pain kind of broadly. The DRG will help us get pain that is very specific. So if somebody has pain just in their great toe, for example, DRG will help them. If somebody has pain in just an area of their groin after they've had, for example, a hernia repair, but they had nerve damage where that hernia repair was done, this will help them much more specifically than something like traditional spinal cord stimulation. So the video that was just playing shows us the placement of those stimulators, and all of this would be implanted under the skin so the patient doesn't have to see it, and you can turn it on or off with a remote control and turn it up or down like a remote control to help you with your pain specifically. But The beauty of those stimulators is that we're actually able to do a test version before you're committed to having it actually implanted into your body.
Does it work? And if it does, let's move forward. If
Exactly.
not, this is probably not for me.
Exactly right. And so there aren't many surgeries that you can actually take out for a test drive, right? Because once you've done it, right? With this, we'll know whether or not and in what way it's going to make a difference in your pain before we commit to it. And that's one of the beauties of this one.
Fascinating discussion. Hopefully we have helped people tonight. I want to thank Dr. Chaiban for the education and information he has provided tonight and for his work in the Ochsner Health System. To make an appointment with any Ochsner physician, including Dr. Chaiban, or to register for any of Ochsner's Hello Health seminars, you can call Ochsner at a number set up just for you. You see it right there on your screen. Or you can contact us by email too at hellohealth@ochsner.org. As a reminder, you can rewatch our presentation or many of our Hello Health programs on our Ochsner website at ochsner.org. Just type Hello Health in the search box. Our final thanks, as always, is to you for your support of this program, Hello Health. Thanks for watching. We'll see you next time.